The opt-out amount will be based on such as a calculation as your RVBZ, which is paid already separately. So we'll use that percentage and range in which we have had discussions with the unions on who will come back with a viable amount, and we will see what can be done or where we can meet each other in the middle. That's part of our dialogue and discussion that was held with the amount. Next. How do we prevent people from taking advantage? Undocumented persons that work under 20 hours a week, seasonal work, they'll be prevented from people having fake or small jobs. So you have to work basically more than 20 hours a week. So you're not just going to come and say, okay, I'm here on the island, I have a job, I'm working less than 20 hours a week, I want this insurance, because then that will create advantage and a collapse on the same system we are trying to save. Steps to prevent medical migration. There'll be a waiting time for expensive care for newly insured persons. Newly insured persons means persons that are not and have not ever been registered on St. Martin. You will be, if you are working, you will receive care, but there'll be an assessment done where it pertains to like cancer treatment and those type of stuff. Persons who have never contributed in the funds of St. Martin, who have never worked in St. Martin, you won't be able to just come and say, I want to come to St. Martin and work to get care for my treatment. So you will be able to get care, but there'll be an assessment done to see if you were having treatment before, where you were staying, etc., etc. Next slide. One of the burning questions and the burning rumors is that there will be no longer SZV. SZV will be no longer. There will be SZV, and SZV will manage. So when we say that, persons ask, can SZV manage this fund, manage the SAHA? And I can confidently say I think they can, because SZV has been established at the end of 2010 and has made significant improvement, especially over the past years. I'm happy to say that while I'm blessed to be in the seat, under my leadership, SZV the last 2 years, 2021 and 2022, USZV was able to obtain and maintain an unqualified auditor's report for its financial statement following continuous improvement and reporting process. So it is important and demonstrable progress has been made with SZV. So I can confidently say SZV will be able to handle such. One of the many questions that we get as well, why don't we learn from Aruba and Curacao? We have taken the lessons learned from Aruba and Curacao. For instance, Aruba, the problem with Aruba was the fact that they did not have a grip on the healthcare providers, a lack of grip and care consumption, as well as a grip on the providers. So what happened with Aruba, prepaid card holders, they moved from a set standard price to a price per service. A price per service, which means that every time you go to the doctor, there's a bill, but there was no control. Documents has proven that some care providers in Aruba collected up to $400,000 monthly based on this new adjustment. I don't know if you guys saw, you members of parliament and the viewing and listening public saw the recent article where SZV has also caught on to some care providers who were sending in invoices for consultation repeatedly, and once contacted the patient stated that they have not visited the doctor that frequent. So even in St. Martin, we were able to catch some care providers that have been performing fraudulent activities. And this is one of the biggest problems in Aruba. The main problem with Curacao was insufficient premium income because too little people were included. A large group opted out, and there was no solidarity fee added to continue. And what happened is those groups that opt out, once persons become seriously ill or no longer qualified for those insurance, they then fell back on Curacao. The government workers were not included for the first year. This is something to be important as well, where Curacao learned undocumented persons who can contribute to the income were not included. So even if you were working, they did not accept your premium. But SZV, the undocumented part is not SZV's responsibility. SZV only looks if you are contributing as a laborer.
Healthcare is needed by everyone. Healthcare is needed or is there for everyone. But reality is not everyone can afford healthcare. And I believe it is good to do our utmost, and I believe Article 16 of our Constitution states that persons should be taken care of equally, no matter race, no matter nationality. So it's there. It is our responsibility, based on the Constitution, to do so. But Mr. Chairman, the matter of sustainable health care is important, but I don't only look at the issue of it being available, but I look at the issue of it being affordable. You see, because the reality is that I might go into the pharmacy and there's a particular medication that is not covered by SZV. But a senior citizen who has a small income has to still pay for it, Mr. Chairman. And that, I think, has to be looked at seriously. It has to be looked at. Because they too need to be cared for, Mr. Chairman.
That it's a one-time option. One-time options means what, Mr. Chairman? That you cannot go back and opt out? And what is the financial ramifications of opting out? How much would a manager have to pay? What's the fee assigned with opting out for the employee and for the owner of the business? But my question through you, Mr. Chairman, is actually to, I don't know, the government or to the minister. What is the Labor Affairs doing to combat this? Because here I have, a couple of weeks ago, a person called me. She said, I'm pregnant. My boss is not going to renew my contract, but I never received SZV. I called SZV, and SZV said I'm not in the system. What happens then? Does SZV sounds the alarm to the Labor Department? What are we doing to combat this? And are they because I mean, that's the first thing usually they do. They run to SZV, say, here, I need my SZV, and SZV say, you're not in the system. But I work for ABC. What would SZV do with that information? Would SZV sound the alarm to the Labor Department? And is there something being done to combat this?
The steps to prevent medical migrations are noted, but what measures are in place to handle potential abuse from within the system and even by our very own residents? Looking at the broader scope of the SAHA's coverage, I'm both optimistic and cautious. The addition of the new benefits like dental and optical care for everyone is certainly progressive. However, how does the system plan to sustain these additions in the long term without incurring significant hikes in the premiums? Given the past financial challenges of the SZV, what measures are in place to ensure that they can manage the SAHA effectively? It's reassuring to see that we've taken lessons from Aruba and Curacao to inform our approach. What specific steps, however, have been integrated to avoid the challenges experienced by these nations in their healthcare initiatives?
National healthcare systems are complex and bureaucratic. We would say, though, that they are, in general, according to my research, more beneficial to the population than, let's say, the systems that the United States use, right? We hear horror stories of people literally dying because they cannot afford to access healthcare. So, in theory, this system is supposed to be more beneficial to our population. The minister mentioned, though, that premiums from government had not been collected for, I believe, a decade, and that is why our funds are, maybe more than a decade, our funds and even the pension are in jeopardy. And so I would like to know, through you, Mr. Chair, what specific mechanisms will be put in place so that this structure won't eventually become jeopardized in the future? Because the saddest thing would be For 20 years from now, I don't know if the same faces might be in here, maybe, maybe not, but we'd be discussing, maybe, I was looking at the minister, maybe the same faces will be in here, but we would be discussing the same thing, right, about saving funds because of poor compliance and mismanagement and so forth. So I would want to know specific mechanisms that would be put in place, because I think that this is important, not for me, Mr. Chairman, but for, my children, our children, the generations to come.
And last week, the minister went to Parliament with a presentation where he tried his utmost to portray a picture that was a complete farce. What I found cute was when he said, but now we're busy in the information phase. You wrote a whole law proposal, let me say a law proposal, and now you're asking for feedback? But why you didn't do the feedback study first and then put everybody's position on the wall and then make the law, trying to get the positions in line with the feelings of the people? Because this law is for the people. It's not for SFV or for government or for the businesses. It's for all. It's for the people. All of us. All entities included. And then you come with the best possible solution that will keep the law sustainable and affordable. Remember, 74% of our country lives below the poverty line as set for 3,500 guilders as a livable wage. These are fundamental departure points, Minister. They are fundamentally important. Now, when you start talking about earthly care, then I know that you're at the verge of jumping off something. You cannot, Minister, be trying to compare yourself to Barack Obama. You cannot be doing that. Just like the Prime Minister comparing herself to Mia Mottley, that is craziness. That is craziness what you're all doing. You can't do these things. Work for your country, brother. If St. Martin is your country, you work for your country. And you do the best that can be done for your country. And someday there will be a statue for you or name a road after you. But a healthcare is a healthcare. It's country St. Martin's healthcare. It's the national health insurance of country St. Martin. That's all it is. No more, no less. We need to get off of these type of sounding nice things because they are dangerous when we behave that way. I went to the union meeting and I saw the questions that were put on paper for you. I believe it was 90 plus questions regarding medical and all kind of different things, and 17 questions based on the the sustainability of the care. And I'm not going to go through all of those because I'll be here still tomorrow. But clearly is that only now they are talking to stakeholders about what they would like to do in 2025 and beyond. 2024 is out of the question already. Ain't going no place. No law ain't passing before 2024. The trajectory is going to be too long. So the ombudsman has 6 weeks minimum to look at a law. So even if they try to rush it through, it ain't gonna be ready for the 1st of January to implement, which means it goes to 2025 automatically. It has to be implemented on the 1st of January, not the 1st of February or the 1st of March, 1st of January, and it can go retroactive. Now, the union listed 9 points, principal points of concern, and these had to do with people not being aware of exactly what this national health insurance was, and that they didn't understand the perspectives on what is going to happen, how it's going to happen. Civil servants didn't receive their COLA indexations over the years, and our healthcare is linked to their wages. What does that mean exactly? They're talking about preventive measures, but fruits the prices of fruits and vegetables are increasing while the wages are not increasing. I just now told you about a basket of goods and the fruits and health. This is where you can see that people are looking at it from different angles. They found that there are too many loopholes in the law. In the off-season, employers put their employees to work 3 or 4 days, give them vacation, or put them to work 1 day a week. However, they still need to pay medical coverage. Mental health is not considered an illness. Drug and alcohol abuse, addiction is not considered illnesses. Government care about saving money by only allowing generic medication to be used while not caring about the health of the populace, as many persons are allergic to generic medication. Seniors have been used to using special types of medication for many years are now being forced to use generic medications and have to wait until they get an allergic reaction to be changed back to what they usually use. This is dangerous and irresponsible.
Your social and health insurance is your social and health insurances.
Are you SXV insured? Do you have a valid medical insurance status? SXV is cardless. Request your My SXV account today and enter the virtual office of SXV. Go to sxv.sx and sign up now.
Your social and health insurances.
During the hurricane season, a potential tropical cyclone can produce rainfall that can cause flash flooding and rockfalls. Stay away from flood-prone areas during heavy rainfall, such as Jump Up Casino on Emil Plain Road in Phillipsburg, ATLH Road Roundabout, L.B. Scott Road from Emilio Wilson Park until Cake House Supermarket, Zaker's Gut from Petro Plus gas station until the Seventh-day Adventist Church, Welchelaken Road K Hill from Welchelaken Road Roundabout until the One Tete Loke Roundabout, Beacon Hill Road from Sunset Bar and Grill until the beginning of White Sands Road, and Rhine Road, also known as Mullet Bay Road, after Sonesto Maho Beach Hotel to the entrance of Kupokoi from the intersection of the University Drive until the intersection of Rio Grande. For more information on how you can keep yourself and your family safe this hurricane season, visit stmartingolf.org/hurricane. This public service announcement is brought to you by the government of St. Martin.
Before 10-10-10 and before 2014, some people get together maybe a few days before election, a few days before nomination day. They would come together and say, okay, we're going to run on a list. The National Ordinance on Registration and Finances try to establish that you form an association to enhance the democracy in this country. An association in which the members of the association would have a say. And together, then you would go and adhere to certain conditions and then nominate and go to the elections. We have seen a lot of interesting articles of association. And there's a word in Dutch, a proverb, a word that says, papier is geduldig. Why am I mentioning that? Because those tremendous articles of association oftentimes would never adhere to. When one has to, for example, indicate what kind of finances one has received, there was also an issue. We always had an issue. We have looked at, just like others, What kind of system will benefit St. Martin? I do believe that no system will benefit if one doesn't have a strong foundation, and a strong foundation would be to have a strong political party, a foundation. It's not a party, it's not a group of people that come together only during election or just before election. A party is also not a group of people that, because there is no common ground, they can just walk away at any time. A party has to reflect a sort of a long-term marriage with certain goals and certain objectives. So when the parties were registered according to certain conditions, and we all thought, okay, now things are going to change in St. Martin. Okay, now we are seeing that the parties are coming with a group of people. In the end, we still see too much of individual campaigning and individual me. We want to suggest that although there are certain benefits to the lynch law, nevertheless, the lynch law tends to undermine the foundation of a party. And why? Because when people want to say, I got to get more votes than the leader, I have to get as many votes because then we have power in our hands. Actually, a party should function as a party. We can check it, look on the front side. There's nobody, I noticed that we're looking all over the world. We're looking in England, we're looking in America, but right here next door, we can learn certain things from the manner in which people go to elections. A party should have proper training of their people, not only those who will be going in government, but of all their people. The association is an organization of which people should be paying their fees. That's an association. It is still difficult for me to find a party that religiously have seen their members paying their fees and keeping that association vibrant. A party in the National Ordinance on Registration and Finances of Political Parties, a party has certain conditions, certain obligations, and so the party twice a year has to submit a list or a register of their donations that they have received the year before. That same party, which is an association, also has to submit financial records before the 1st of April. Now, when you have a parliament of 15 members, of which 5 are independents, and there are 5 parties, the 5 parties will have to show up at the Electoral Council. They are required to do so, but not the 5 independent members. So one would have to see, countries have to look at some of these things. As a matter of fact, the independent members who are deflecting from their party seems to be getting a pat on their back for deflecting because they get staff, they get office, and they are suddenly on the same level as their former political leader, as faction leader.
Your social and health insurance is your social and health insurances.
Are you SXV insured? Do you have a valid medical insurance status? SXV is cardless. Request your My SXV account today and enter the virtual office of SXV. Go to sxv.sx and sign up now.
SXV, yeah, your social and health insurances.
It's hurricane season. Are you prepared? Here are a few tips to keep in mind to help keep you and your family safe. The Atlantic hurricane season runs from June 1st to November 30th, with the peak occurring between mid-August and late October. This hurricane season, be sure to put together a go bag. A disaster supply kit including a flashlight, batteries, cash, first aid and supplies, medications, and copies of your critical information if you need to evacuate. This public service announcement was brought to you by the government of St. Martin.
Free. Yes. Yes, I agree times 3. Let's sign an accord outlining how free our people are allowed to be, as our forefathers did. You see, this was simply the wish of an idealistic kid. We all wish that they did. But instead, we adopted our agreements from the deathbed of a broken and gone constellation. We forged a nation. We opted for an adaptation and forged forward in the creation of this country within a kingdom. Our freedoms, we did not win them. Yet one was our referendum. Well, so says some. And so we kept on. We held strong to our song. Oh, sweet St. Martin strong. Oh, sweet salt paradise long gone. And still we sang on. Through unity and through flag, we can now humbly brag. It is now our turn. Tag. As we lead the way, as jollification reigns today, as man, as woman, as child, we agreed to be free and outlined what is wild. Within a framework of legal contributions, those accords must never lack reviews or evolutions, because time keeps changing, a logical revolution. And so should be our understanding of our own constitution, lest we face persecution if we forget our resolution. We agreed to be free, framed against a distinctive purview, as we today yet again celebrate all of you. 13 official years of St. Martin's autonomy. This is how our people chose to be. So again, I do agree, and I say to all of thee, Happy Constitution Day 2023. Thank you.